We've all heard it, you must drink water and plenty of it. But can you drink too much? And what actually happens to the body when water intake goes way beyond what's considered normal? I remember the first time I heard about water intoxication. It sounds absurd. How could something as essential as water become dangerous? But in nursing, you learn quickly that anything can be harmful in excess, even water. Water is crucial. It regulates body temperature, transports nutrients in our body, flushes out waste, and keeps our organs functioning. But the body operates within strict limits. The balance of sodium, potassium, and other electrolytes is critical for survival. When you drink too much water too fast, your kidneys struggle to keep up. They can only process about 0.8 to 1 liter per hour. If you exceed this, water starts to accumulate in the bloodstream, and that dilutes the sodium level. This is called hyponatremia, and it can be deadly. Sodium plays a vital role in nerves and muscle function, including the electrical signals in our brain. If the sodium levels drops too low, then water moves into the cell to balance things out, including the brain cells. The result? Swelling. And when the brain swells inside a rigid skull, pressure builds up, leading to headaches, confusion, seizure, and in extreme cases, coma or death. And in my years as a nurse, I've seen patients come in with symptoms that at first didn't make sense. One case stands out: a young athlete, a runner who had collapsed during a marathon. Dehydration, I thought. But when we checked his sodium levels, they were dangerously low. It turns out he had been drinking massive amounts of water throughout the race without replacing the electrolytes. He was showing signs of water intoxication, not dehydration. Another case involved a psychiatric patient who had developed a psychogenic polydipsia, a condition where people compulsively drink water. This patient consumes liters upon liters within a short time, leading to severe confusion and convulsion. Despite rapid intervention, the damage was unfortunately significant. These cases aren't rare. Hyponatremia occurs more often than people think, especially in endurance athletes, people on certain medication, and even overzealous, health-conscious individuals who believe that more water is always better. So that leaves us with the question: how much water is too much? The answer depends on factors like body weight, kidney function, and activity level. But generally, consuming more than 3 to 4 liters per hour can be dangerous. That's why guidelines recommend spacing water intake throughout the day, rather than chugging a large amount at once. And let's be clear, this isn't an issue for most people. If you are drinking to quench your thirst and eating a balanced diet, your body will regulate itself. The dangers arise when people force excessive water intake, whether due to misinformation, extreme dieting, or competitive challenges. And before you ask, yes, there have been deadly water drinking contests, so don't make a contest out of it. But let's look at some real world consequences. Take the infamous case of Jennifer Stranger, a woman who participated in a radio station contest called Hold Your Wee for a Wee. Contestant had to drink large amounts of water without urinating. She died later from water intoxication. And she was in on this. She drunk and she have signed all the waivers, but she wasn't informed. And I bet she didn't know the consequences, because hours later she died from water intoxication. But moving on to considering military training, when soldiers are sometimes instructed to drink excessive water to prevent dehydration, there have been documented fatalities where overhydration led to hyponatremia causing brain swelling and death. And even infants can be at risk. Diluting baby formula too much or give an infant excessive water can throw off the electrolyte balance, leading to dangerous complications. So remember to follow what it says on the tin. That's the point of this. But looking at it from a scientific perspective, it is fascinating how something so essential to life can become harmful when taken to the extreme. We often hear about the dangers of not drinking enough water, but we rarely talk about the risk of too much. The key takeaway is balance. Drinking when you're thirsty, spacing out water intake, and understanding your body's needs will keep you safe. Because in the end, even water can be too much of a good thing. And a warm recommendation I learned in the fire department is that if you drink water half a liter throughout the day, a couple of hours before training and a couple of hours after training and during training, you will not overhydrate, you will not dehydrate. So that's an advice, but remember, I'm no doctor. Disclaimer in the description. And besides the disclaimer, you have to watch this video. This video is specially picked just for you by YouTube, and I'll be looking forward to seeing you right over there.